Welcome back to the Value Analysis Program. In this section, we're going to discuss purpose. And it may seem kind of obvious that every program is going to have a purpose, but a lot of times it's not specifically stated. And that's usually one of the first things I notice with programs. And it doesn't matter if it's value analysis program or any other type of program. When I ask people, what's the purpose of your program? They go, well, I don't know. We were told we're supposed to put together a program. That's why we did it. And it's like, that's not a purpose. You want people to rally around something. You want them to think about this. You want them to start to say, okay, I understand why we're doing this, and that's why it's important for doing it. It's amazing how many times I do not find purpose built into programs, and it's over and over again. People think they have a purpose, but when you ask them, they usually give you some pretty lame excuse like, well, I don't know, we were asked to do this, and that becomes their purpose. Not a purpose at all. In fact, actually, when you saw that list in the previous section, it had the 7 elements. A lot of times people look at me and go, well, it seems kind of obvious. Those 7 elements make sense. But, what's the big deal? And I say, it's not that the 7 elements are a big deal. It's not that shouldn't be a surprise that having those 7 elements built into your program increases its likelihood of success. What's really amazing is how many times I go out and look at programs, and what I'll find is how infrequently those 7 elements are built into a program. It's absolutely amazing how that happens. And people don't realize that when they don't do that, they're handicapping themselves from the very beginning. They're creating obstacles, they're creating cross alliances, they're creating all kinds of problems for the program that they didn't even know they were going to run into because they didn't have these 7 elements built into it. So you're going to hear me sort of harp on this, and the reason is because more often than not, if you're looking at this program, you've already figured out that you probably don't have some of these elements. But I'm going to show you how to build them in, and it's not really that difficult. It's just that they have to be there in order to be successful. So we talked about this before, why a structured program. And for me, it was really the eye-opener was when I saw this in robotics. And we just simply saw that when we started looking at and evaluating what we meant by structure and asking our facilities, do you have structure around robotics? And we're going to use that as an example. And what we found was every facility that had a robot that was being used for robotic-assisted surgery would inevitably say, well, of course we do. We have a robot. And they made the connection that if you have a robot, therefore you have a program. Some people would go even as far to say as, well, of course we do. Didn't you see our website? We've got the picture of the robot on the website. We have a program, and so they were marketing things, and they had a piece of equipment, and they thought that was a program. And it's not, as it turns out. So we went and surveyed all of our different programs. We had 13 facilities that were up on robotics, and started asking what they were doing. And what we found was that some of them were very highly structured. In fact, actually what we found was those that had the most highly structured programs, and we'll go into what we mean by that, but those that had the most highly structured programs also were performing better. In fact, if you had a less structured program or no structure, you had a complication rate that was 46% greater compared to the ones that were highly structured. And your costs were 37% higher compared to highly structured programs. So it became kind of obvious to us that having program structure was going to be important for performance. This started to roll over in other areas. I saw this in orthopedics programs. I saw this in our value analysis program. I saw the same thing in our clinical practice programs. The lack of structure is what creates problems for you. And a lot of times these are problems you don't even know because you're just defaulting back to what your usual practice is. It isn't until you get some structure behind it that you can really kind of start to focus on how to improve things within a particular area, within a particular program. And this program obviously is focusing purely on value analysis. So if you want to improve patient care, resource utilization, and costs, then you got to have a highly structured value analysis program because programs matter. And but more importantly, highly structured programs matter the most, and they get the best performance. So that's really what you're going to want to do. If you're setting yourself up and you're putting yourself in a position to have a value analysis program, why not make it the best it possibly can be? Have some structure behind it. So the other thing is it formalizes an organization's commitment to value analysis. A lot of times that people, I've sat in meetings and people throw this phrase around value analysis all the time, but when you say, does your organization really do value analysis? Well, yeah, of course here. A lot of people are focused. A lot of people do value analysis. Do you have a value analysis program? Do you have a committee? Do you meet? Do you have goals? And And all of a sudden, the wheels start to come off the cart very quickly because people go, well, no, we're not quite like that, but we believe we have one. It's like, hey, believing you have one and having one can be two different things. So it's important to understand and be able to define exactly what it is. It also helps your organization identify the most cost-effective supply solutions. Every problem out there that involves supplies wants to find the best solution. And so having somebody focused on finding that best solution for you, or you doing it for yourself, is really what this is all about. And it involves your clinical staff. So because it's doing that, you start to develop this collaborative relationship between clinical staff and administrative staff. It's always, I shouldn't say always, but it's as a general rule, it's been fairly adversarial in nature between administration and clinical staffs. Clinical staffs are always asking for more resources, and administrations always sounds like they're saying no. Well, as it turns out, there's a limited amount of money to spend, and you have to focus that money on the things that are going to give you the best solution. And the problem is that a lot of times clinical staff have been excluded from the conversations. So now you start to develop a team structure, a program structure that incorporates the clinical staff and starts to get their opinion. Why? Because they're the subject matter experts. They have direct working experience with the products. And so they're the ones who are going to help you determine the most appropriate supplies. Unfortunately, a lot of supply chains in the past have been very dependent on the vendors to tell them which products are the best products. Well, of course, they're always going to pitch their own products. And then they get a few physicians out there that might be assertive enough to say, well, I want this product. But it may not always be the best product and may not be the most cost-effective supply solution. So it's better, I think, to have a group look at it and look at the evidence behind it and also start to see how it's being used within the organization and therefore, is it really the best supply solution? It also builds, I think, credibility. It builds that buy-in and trust with the health system's medical staff for other types of mission-critical decisions. So people in administration, this trust thing goes both ways. And so in the past, medical staff haven't always been brought in these discussions. This is a great way to bring them into the discussion. And not only that, but it builds trust. And now all of a sudden, it's not just supply solutions that you want to talk about, but maybe there's other things important to the organization. And physicians can now have some decision-making involvement in the decision-making for those mission-critical decisions. So I think it's a way to build trust, and it's actually, I think, been very beneficial for the organizations I see who do this really well. It also builds, brings in the best of evidence-based medicine and practice-based medicine. So evidence-based medicine is sort of the literature that's out there. Practice-based medicine is kind of how people are really using it. And it begins to inform supply chain and influence the purchasing decisions and the strategy behind it. Because now you're walking into it feeling like you have somebody who really understands how the products are being used. And that's the important thing, is really understanding that there are good ways and bad ways to use particular products. Even though there may be some literature out there to support it, physicians are going to have a lot of, and nurses are also going to have a lot of working knowledge of these supplies. They'll tell you if something really is working, because just because something's FDA approved doesn't mean it's the one that works the best. And so having informed decision making behind it is very helpful. When people say, well, what is a purpose? And I always tell them, look, you probably need to have it written down somewhere. So I wrote down, I've got here a list of 5 different purposes, but I really do think it's up to you to come up with your own. But here's a suggestion. I think it's to identify the most cost-effective supply solution. It's going to have other purposes, but I think right off the top, that's probably going to be the first one. You should make that known to your membership. Everybody in the program should know what your purpose is, whether you buy into the ones that I've got listed here or not. Whatever purpose you derive, you got to make sure your membership knows it, and your stakeholders know this too, so they understand why you're doing what you're doing. I think it also develops the resources, the financial reserve, and the skill sets needed to improve clinical operations and care delivery. And so what do I mean by that? As you develop supply savings and identify the most cost-effective supply solutions, you start to build up a reserve, not only of trust and credibility, but literally a financial reserve. And that financial reserve can be used to invest in other types of resources. As you're doing this, you'll develop a skill set, you'll develop the collaborative spirit between administration and the clinical staff. And I think that's ultimately where you want to take this, is to improve your clinical operations and your care delivery. And so these are the first steps to doing that. So to me, that's also a purpose. I think you need to find the right balance between quality and costs that leads to excellent patient care. And not only that, but a great work environment for those who provide that care. There's nothing more frustrating. As I worked for years as a surgeon, I could tell you nothing more frustrating than sitting there in the operating room asking for a piece of equipment or a supply, and somebody brings in something, and you look at it and you go, "That's not the one I'm used to." It's like, "Yeah, I know they changed it, last week," and you're thinking, who made that decision? How did that happen? I start to get angry. The nurses aren't comfortable with that, and it always made for just bad relations in the operating room. The problem is that the people who made the decisions weren't even in the operating room at the time or ever, for that matter. So I think it's making sure that people feel comfortable in their work environment. When they feel like they have a say in product choices, they know it's going to be there, and they know what's going to be there when it's going to be there, and that's really what I think helps provide that improved work environment. I think to evolve into a value analysis program, it has to at some point start to become integrated with your population health management. That's where a lot of things are moving today in the country. I think as you get more and more developed, as you develop a mature model for value analysis, you'll start to see how it impacts population health management. What I'm going to describe in this program is really sort of how to get programs started up. It's not about how to get it integrated into population health management, but I think as you start to evolve your program, you'll begin to see how that will integrate into population health management. So you got to start somewhere. Today's the first step. Down the road, you're going to mature into a much more highly developed program, and when you get there, you'll be able to take on population health management. So in summary, it's because a formal, organized approach to value analysis produces better outcomes at a lower cost compared to not having a program. Just sort of going out by the default and saying, well, let's hope that supply chain makes a good decision about this, or I hope our vendors are being honest in how they portray their products, that's one way to do it. That's how we've done it for decades. And, it's actually not been a bad system if you think about it. But we know we can do much better. So why choose the default system when you can choose one that leads to better outcomes, and certainly at a lower cost? So to me, that's the reason why you really want to do this. You want to have people engaged in this process, and we'll go into that specifically when we talk about engagement. So any questions, feel free to contact me. You see this, my website and also my email address. We're now about to start the next section here, which is engagement. And this is particularly going to be addressing physician engagement, because that's probably the one that I hear the most about, is we just don't have physicians engaged. And you'll see that I have a slightly different opinion about that. But not only that, but I'm going to show you how to get engagement within your program. And with that, have a great day, and we'll see you in the next section.